So acute pulmonary edema. So crackles are a sign of pulmonary edema, just because it's just this thin fluid that's blocking up the alveoli. You are a lot of times going to hear it more in the lower lobes because it's dependent. Everything's going to sort of more flow to the bottom part. Cardiac symptoms. So with if you have problems with the heart that's causing pulmonary edema, then you're going to have other cardiac symptoms. Another big issue is peripheral edema. You can have swelling in the lower legs. So if you have a patient with heart failure, if I walk up, first thing I'm going to do is take a look at their lower legs, because if they've got a whole bunch of fluid buildup down here along their legs where it's dependent, then, so if you've got, there's a difference between left heart failure and right heart failure. But if your left heart is failing and you've got swelling down here, then your right heart can also be failing and causing issues with causing edema in the lungs. So you can have swelling. You can have swelling in your hands. You can have swelling in your face. A really big important thing is for heart failure patients, these patients are going to know exactly how much they weigh, because they know that when they've got extra fluid they weigh 210, and when they're lean they're 195, and so that that extra 15 pounds is all water weight, and that water weight has to go somewhere. It's going to go into the lower legs and go into the lungs and go into their hands. So, and you'll see lower leg edema. You can push into it and it's going to indent, and yeah, it's nasty. But cardiac symptoms, anxiety, combativeness, confusion may complicate assessment. That's going to be true for any patient in respiratory distress. Positive pressure ventilations may be necessary to push out all of that fluid. CPAP, oxygen, keep the patient in upright sitting position. So if they're sitting up, then that fluid is going to stay in the bottom. If you lay them flat, then all that fluid can also just sort of move around. When we have patients in the hospital and they've got this, we lie them flat and you keep them there for 24 hours, then the fluid is going to be all along the dependent regions on the posterior entire backside. So these patients are going to know that they can't tolerate lying back. You're gonna, it's and for heart failure patients, they sleep sitting up. You'll learn all about how to ask these questions of, how many pillows do you sleep on a night? Well, I normally sleep on 3, but the last couple of nights I've needed to sleep on 5. Okay, well that lets you know, how bad it's getting.
This might sound like a silly question, but why don't you just turn them upside down and let the fluid just flow out their mouth? Why doesn't that work?
So there's way too many barriers. It's not going to be able to go, from the lungs up the airway. Yeah, it's just too many barriers for that. Spontaneous pneumothorax. So between the lungs and let's say here's the person's shoulders. So there is a lining, a thin lining, all along these lungs. And so this is, the pleural, and this right here is the pleural cavity. And how your body is actually able to expand the lungs is that sort of your diaphragm, in a simple way to think about it, is that your diaphragm is connected to this pleura in kind of a different way than it's very simplifying. But so when this goes down, this pulls this pleura down through negative pressure. You guys heard about negative pressure ventilations? So as that goes down, it forces the lungs to expand. So when we talk about a pneumothorax, a spontaneous pneumothorax, is that sometimes, naturally, a lot of times in people with connective tissue disorders, or you see this actually a lot in young, healthy males, is that on the outside of the lung, you can have like a little bleb. like a little air pocket. And these can actually pop. And so when they pop, all of a sudden, it introduces a whole bunch of oxygen into this, very, very narrow space that depends on negative pressure. So all of a sudden, you've got all this extra air that's not supposed to be in there, that then pushes on the lung. So
Throws off the negative pressure.
yeah, kind of. Not so much it throws off the negative pressure, but
So, why is that in younger males?
what's that?
You said young. It's more common in young males.
Yeah,
Why is that?
teenage males. Teenage males
Yeah.
is when you're more likely to see spontaneous pneumothorax. As to why